Well, that'll be a fun one. And you hear about celebrities who swear by intermittent fasting, but is it safe and how do you know if it would work for you? We've got Dr. Aimee Duffy here, a physician in Clemson and also the author of Normal Does Not Have Side Effects, here to explain this hottest trend. Welcome.
Thank you. Great to be here.
First, there are different types of intermittent fasting to be aware of, different ways we can schedule it, right? What do we understand there?
Yep, I break it down into two ways just to make it super simple. You've got the calendar way or you have the clock way. For the calendar way, it's really easy. Pick 2 days of the week. Those 2 days you're going to fast. The other days you can eat normal. Now, make sure they're not 2 days in a row. And if you want to switch it up next week, let's say you got a hot date on Tuesday, you want to flip it around a little bit, you can change it up.
But you're saying days. 2 days, pick them of the week, and that whole 24-hour period.
Yep.
Okay.
You're fasting for the whole day.
Yeah. That feels doable when you cross it out on a calendar. And then for the time, a similar way.
So the clock way is you're going to pick a period of time during the day. So you're going to do this more every day. Pick a period of time. Let's say we're starting at noon. You start eating at noon. You stop eating at 6 p.m. Don't eat again until noon the next day. You've fasted for 18 hours. Super easy.
So at that point, you're focusing on when you're eating, not ruling out what you're eating. And so you say that's what makes it simple, that it's not about calorie counting or eliminating favorite foods?
Exactly. So sometimes the difficulty with diets is that restriction. So much restriction. I want to eat this or I want to eat that. You want to have a glass of wine? You can have a glass of wine or a beer. You want to have your favorite food, chocolate cupcakes? You can do that as long as it's in your eating window.
Okay.
Now, if you want to make sure that you're getting the best results, obviously for weight loss or just health in general, you want to make sure you're getting your fruits and vegetables, not just gorging out on your chocolate or drinking the entire bottle of wine, right?
Right.
And most importantly, make sure that you are staying hydrated, especially if you do the whole day fasting. You've got to stay hydrated. That's really important.
And you recommend intermittent fasting a lot to a lot of patients these days, but not everybody's the right candidate. How does somebody know if intermittent fasting is going to be a fit for them?
Yeah, it's really easy and safe for almost everybody. There's two types of people that want to pay a little bit more attention. So if you're diabetic and you're measuring your blood sugar, whether you have this or you have one of those continuous glucose monitors, if you're on insulin, this can be a little bit tricky. So make sure you're talking to your doctor about whether it's right for you or what adjustments you might need to make. And if you're on medication, especially ones that need to be taken with food, then you need to pay attention to the timing of that as well.
What is it about intermittent fasting that gets people tripped up? Are they thinking, you're starving yourself, that's not bad? Or what do
I think that's
believe?
The scary thing is, we were always taught, make sure breakfast is the most important meal of the day. And there's a lot of theory about eating more frequently, small meals throughout the day. But really, when you get into the fasting mode, especially if you get into the 18-hour, we're starting to see not only fat loss, but you're seeing reduction in inflammation. It gives your body time to heal.
And what makes intermittent fasting something that you're especially interested in? I mean, you must be hearing success stories and seeing people change their lives.
Yeah, it works. And because it's so simple, we're not so focused on don't eat this, don't eat that. It's just finding a period of time. And once you get used to that, so many people don't eat breakfast anyway. So if you can just stretch that out a little bit or be more conscious, a lot of people are just drinking and eating things without being any aware, right?
Yeah. And if you're going to enjoy it, you could sit and really think about it, but a lot of people are just putting it down. You've got a lot of information. You're a physician, a lifestyle architect, a wellness mentor at Carolina Integrative Medicine. And I know you're passionate about mentoring people in many different ways. What is it about your philosophy and your practice that kind of sets you apart?
I think for us, like you said, I'm a lifestyle coach and a mentor. So rather than being doctor, really the Latin term for doctor is teacher. So it's all about if we can help the patients to understand the why or the how to do things, spend the time to really have that conversation, we're going to see much better results and get people living their best life.
Yeah, and that's why you're passionate about this. You even wrote a book. Tell us about that.
So I wrote a book. It's called Normal Doesn't Have Side Effects. So if we're doing things the right way and getting your body back to normal, we don't have to worry about, what side effects that you're going to expect with a medication. It's, you're not going to have a side effect from a food if it's the right food for you.
Wonderful. Well, you make it so relatable and easy to talk about. We look forward to having you back real soon.
Love it.
Yeah, thank you very much, Dr. Aimee Duffy. We'll appreciate it.